Hi, I'm now going to show you how to identify and correct a problem called a hiatal hernia. And helping me is Helen from Russia. She's visiting America. And first thing I want to say is Helen is the typical kind of person who has a problem with the severe hiatal hernia. When people are tall and slender, they're the ones that have this problem the worst, although it can happen in anybody. And Helen, you've had asthma, and some other health problems, right?
Yes.
And we've been working with this with her a little bit, but I want to demonstrate first of all how you identify this with muscle response testing. So I'm going to push her arm, I'm going to check her polarity. Like this, and now I'm going to go right here to the solar plexus. Right here, I'm going to hold, and you see she's weak there. And just to demonstrate, I'm going to check some of the other things: nervous system, pituitary, lymphatics, thyroid, thymus, lungs, blood, heart, and circulation, liver, colon, small intestines, kidney, adrenal. So there's a number of things here that are testing weak. Now what I want to show you is I'm just going to really quickly just flick like that, like I'm pulling her stomach down just a little bit, and I'm going to retest her. Hold. Thyroid, lungs, lymphatics, liver, circulation. That's still a little weak, but it's better. And this is what happens. The stomach comes down through an opening in the diaphragm called the hiatus, with the esophagus, and then kind of curls around like this. And what happens here is the stomach slides up into the opening in the diaphragm and impedes the movement of the diaphragm, and it also interferes with digestion. It puts pressure on the heart, it lessens a person's ability to breathe with their lungs, and interferes with their ability to digest food and absorb nutrients. So Helen, take a deep breath for us. And notice how she breathes up here with her shoulders. Okay? Now if I breathe, see my shoulders hardly move. But the reason that she has this problem is because her stomach is actually in the way and interfering with the movement of her diaphragm. So we need to correct this. And one of the things that causes this is emotional tension. So one of the things you can do to let go of it before you even begin any other kind of mechanical thing is to practice throwing a temper tantrum. So, and this is very hard for people with hiatal hernia to do, by the way. You grit your teeth and you clench your fists and go like this, like you're really mad at somebody, and you go, take in a deep breath and go, okay. One of the things you notice how that's primarily coming from her throat. In other words, there's this kind of like constriction here. It's really hard for her to do. And people who have this problem usually laugh when they do this because they can't, because it feels uncomfortable, doesn't it? Yeah. So try it again. Let it come from down here. Okay, now take a deep breath. Okay, and a lot of times that will loosen it up a little bit, but in this case it didn't. That takes some practice to get that to drop down. So what we're going to do is we're going to switch the camera here for a second and come back, and I'm going to show you how to correct this with her lying on the massage table. Okay, so we now have Helen on the massage table, so I can demonstrate how to work on this problem of the hiatal hernia. And while you can do this through clothes, it's actually easier to do it on bare skin. So I'm going to just lift your shirt up like this. And you see her ribs coming right here and right here. And right in between her ribs, there's that little soft spot of the solar plexus. And this is where you're going to be doing your work. Now, normally, I would do this a little harder than I'm going to do it right now, but we just got back from lunch, and so you can't like really pull hard on a stomach where you've just eaten. But what you do is you start under this side, and you just kind of gently pull your fingers in here and work your way up to that little spot right there, and you'll feel kind of the stomach moving. And then you have the person take a deep breath and hold it, and you'll feel you kind of get a hold of the stomach, and now exhale hard. And you pull down on that area like this. Only you do it a lot harder than I just did. Let's do that again. Take a deep breath and blow it out. And pull down. You can even just do gently pulling down like this, just alternating your hands like so. And that will help to open up, get that stomach to drop out of the diaphragm. A technique I learned from Deanna Hansen, a certified athletic therapist in Canada, that really helps is also to just do gentle massage on the abdomen, just rotating your fingers around and just kind of relaxing the whole abdominal area, and just doing this for like 5 minutes a day, and especially paying attention to just kind of massaging right here under the rib cage, like so, because this actually helps to bring the stomach down. Now take a deep breath for me. Okay, and what you're looking for, relax, let it go, is you want to see movement right here with the stomach and the ribs rising down here instead of so much up here. And that tells you that you're getting some progress in opening up breathing. And again, I'm just going to work on it just a little bit. And again, take a deep breath. And you can see the movement taking place there. What often accompanies this is a problem with the ileocecal valve. And the way you locate the ileocecal valve is you find the point of the hip here and the belly button, and draw an imaginary line between those two. And right midway on that line is where you'll find the ileocecal valve. You go just below that with both hands and you push, and it's usually a little tender, right? And you basically lift up like this and hold it until the tenderness stops, okay? Which actually usually takes 2 or 3 minutes, but we're not going to spend the amount of time to do that on this DVD. And again, just even doing this kind of gentle massage will help to get that moving. The ileocecal valve is the valve between the small and the large intestines, and when it gets inflamed, it lets material from the colon come back into the small intestines, which causes gas and bloating that pushes up on the stomach. You also may need to work on the valve of Houston, which is an area of the colon that constricts to let out gas. And basically, if you start at the belly button, go 2 inches down, 1 inch to the other side, and go straight down, and that one is often tender too in people who have a hiatal hernia. Yeah, it doesn't feel very good, does it? And you hold that again until it stops hurting, which usually takes about 2 minutes. Okay? And oft times after doing that, you'll actually get some additional benefit right here. Take a deep breath again. Yeah, we got a little better movement that time. So Jack Richardson does this really hard. He really gets up there with his fingers and gets under the rib cage and literally jerks the stomach down. I find that doesn't do very much good, because usually the tension created by that makes it go right back the way it was. So I find working on it gently every day like this is much more beneficial. So that concludes that demonstration. We're going to reset the camera, and I'm going to show you a couple of self-help techniques that you can do working on this yourself, in addition to having someone work on it like I just showed you.